Thyroid nodules. Most thyroid nodules do not cause problems and are not cancerous. They are often hard to notice because they are so small. Lots of people have thyroid nodules that are never found or treated. There are three kinds of thyroid nodules: 1. Solid nodules, nodules that are filled with fluid; 2. Cystic nodules, and nodules that are partially cystic. You can have one thyroid nodule or several thyroid nodules, multinodular goiter. 3. You can also have some nodules that are solid and some that are cystic. Solid nodules may grow slowly over time. In rare cases, cystic nodules bleed, which can cause them to grow suddenly and become painful. Thyroid nodules usually do not prevent the thyroid gland from doing its job. But sometimes a noncancerous thyroid nodule can cause hyperthyroidism. Hyperthyroidism happens when one or more nodules make too much thyroid hormone. Hyperthyroidism is treated with antithyroid medicine, possibly radioactive iodine, and very rarely, surgery. Hyperthyroidism from thyroid nodules is not very common. For more information on treating hyperthyroidism: difficulty breathing or swallowing. Sometimes, one or more large nodules can press on your windpipe, trachea, or on your esophagus. These kinds of nodules have to be surgically removed. About 5 to 10 out of 100 thyroid nodules are cancer. 1. Thyroid cancer is usually diagnosed and treated early, so most people do very well. For more information, see the topic thyroid cancer. What increases your risk? You are more likely to develop a thyroid nodule if you are older. Thyroid nodules are more common in older people. You are female. Women are more likely than men to develop thyroid nodules. You have been exposed to radiation. Exposure to environmental radiation or past radiation treatment to your head, neck, and chest, especially during childhood, increases your risk for thyroid nodules. You do not get enough iodine. Iodine deficiency is rare in the United States, but it is common in areas where iodine is not added to salt, food, and water. An iodine deficiency may result in an enlarged thyroid gland, goiter, with or without nodules. You have Hashimoto's thyroiditis. Hashimoto's thyroiditis can cause an underactive thyroid gland, hypothyroidism. One or both of your parents have had thyroid nodules. Call your doctor if you have any of these signs of thyroid nodules: swelling in your neck for more than 2 weeks, a hoarse or scratchy voice that is not caused by a cold or throat infection and lasts longer than 1 month, a hard time swallowing. Symptoms of a thyroid problem, such as feeling tired, weak, or nervous, losing weight, having trouble sleeping, or having a fast heartbeat. If you have had part of your thyroid gland removed because of noncancerous thyroid nodules, you will need regular medical checkups to make sure your thyroid gland is working well. Diagnosis: the first step in diagnosing thyroid nodules is a medical history and physical exam. Thyroid nodules often are found during a physical exam or during a CT scan or ultrasound of the neck, chest, or head done for another problem. Most people do not find thyroid nodules on their own, because they are difficult to feel and usually do not cause symptoms. Common tests for people with thyroid nodules are thyroid stimulating hormone, TSH, test. This is a blood test to see how well your thyroid gland is working. Fine needle aspiration guided by ultrasound. Material that is removed from the nodule is checked for cancer cells. This is a simple procedure that can be done in your doctor's office. Thyroid ultrasound. Ultrasound uses reflected sound waves to create a picture of organs and other structures inside your body. Ultrasound cannot show whether a nodule is cancerous, but it can help your doctor confirm that you have thyroid nodules if other tests have not been clear. See what is happening to nodules that are not going away. Find your nodule during a thyroid biopsy with a fine needle aspiration. Other tests you may have include thyroid hormone tests. These blood tests are done to see if a nodule is causing your thyroid gland to make too much or too little thyroid hormone. Calcitonin test. This test checks your level of a hormone called calcitonin as a way to help find out if you have cancer. This test will probably be done if other people in your family have had thyroid cancer or any other type of cancer of the endocrine glands. Thyroid scan. This test uses radioactive material and a camera to see how well your thyroid gland is working and to see if you have hyperthyroidism. Thyroglobulin, a protein made by both normal and cancerous cells. High levels of thyroglobulin may mean that the cancer has spread, metastasized, to other parts of your body. If your nodule is not cancerous, your doctor will see you regularly to monitor the size of your nodule. He or she may do other tests, such as checking your thyroid-stimulating hormone, TSH, levels or doing a thyroid ultrasound. If your nodule grows, other tests or surgery may be needed. If your thyroid gland was removed because of cancer, your doctor may test for thyroglobulin, a protein made by both normal and cancerous cells. High levels of thyroglobulin may mean that the cancer has spread, metastasized, to other parts of your body. Treatment. When you know you have a thyroid nodule, your treatment options include observation. If your thyroid nodule is not cancerous, your doctor may choose to check it every 6 to 12 months for changes in size. Many noncancerous thyroid nodules stay the same size or shrink without treatment. Surgery, thyroidectomy. Not all thyroid nodules need surgery. You will need to have surgery to remove part or all of your thyroid gland if your nodule is cancerous or suspected to be cancerous. Your nodule is so big that it makes it hard for you to breathe or swallow. Radioactive iodine. Radioactive iodine. Radioactive iodine may be used to destroy thyroid tissue if your nodule is noncancerous but is making too much thyroid hormone, causing hyperthyroidism. If you have hyperthyroidism because of your nodule and you are pregnant, it is not a good idea to have radioactive iodine treatment. Your doctor may recommend surgery instead of radioactive iodine. You have several nodules, multinodular goiter, and surgery is not a good idea because of other health problems with breathing or swallowing, but your nodule is noncancerous. Your doctor may recommend surgery instead of radioactive iodine. You have several nodules, multinodular goiter, and surgery is not a good idea because of other health problems you have. Radioactive iodine can shrink nodules that cause problems with breathing or swallowing, but your nodules may come back after treatment.